Since Hurricane Melissa in October last year, schools in St. Elizabeth have been in survival mode. Despite determined teachers holding the line, the education system remains under pressure, strained by a slow and uneven recovery. Educators raised the concerns at the third annual Teacher Education Summit held at the University of Technology recently. 5 months on, the scars from Hurricane Melissa are still raw in St. Elizabeth, one of the hardest hit parishes from the Category 5 hurricane. Educators are pushing through, keeping classrooms running despite immense challenges.
I am still without electricity, and I am still without part of
so
my roof.
So many months later.
Yes, I am still without a part of my roof. So rebuilding, and yet still I have to go to work where we are also rebuilding. Especially where my office is located.
Teachers have had to slash lesson plans, shorten teaching time, and focus on what traumatized students can absorb. Outside, they are now tracking down missing students, going into communities to bring them back to school.
Teachers are actually being pressured to get the students back, so they have to be the ones calling the parents, going out into the marketplace, going out into the town centers to find the students and corral them and bring them back into school.
But the crisis is exposing deeper problems.
The guidance counselors are out there too with teachers trying to find all these students, some of them from Hurricane Beryl. We've not seen, and we have to be going out there, to find them. Some of them, the parents will tell you, they say they're not going to school, they're not going back, and we wonder who called the shots and so on. But teachers have to be making sure that their numbers add up and that ex-students are accounted for.
Educators are warning that Jamaica's proposed 2025-2035 education plan barely addresses disaster resilience despite the country's constant exposure to hurricanes and earthquakes. As recovery drags on, the call is growing louder. Fix the system, invest in resilience, and act now.
When I did my own research on principal preparation, I looked at a number of systems all over the world. There is a gradual shift to getting school leaders and teachers to adapt, to get into that mind frame, because systems are going to be impacted. And so we have to respond accordingly. So I'm saying that while the policymakers are at the table, they need to listen to us as teachers, they need to find out what's happening, and so we inbuilt in that some mechanisms so that we can maintain the system as it is.
It's time for a break. Stay with us. More stories when we return. Welcome back to the Midday News. It's now time for the Business Minute.
The Bank of Jamaica is reporting that in net remittances, the difference between funds sent to Jamaica and those sent overseas rose by 5.4% or $13 million to $255 million in January compared with the same period last year. The increase was driven mainly by a 5% rise in inflows, while outflows declined slightly by $100,000. The central bank says the majority of remittances came from the United States, accounting for 67.5%, followed by the United Kingdom at 12.2%, Canada at 8.3%, and the Cayman Islands at 6.4%. Further afield on Wednesday, TSA's Deputy Administrator laid bare the desperate plight of TSA employees still working without pay and the crippling impact it's having on airport security, resulting in the longest security wait times the TSA has ever seen. The airport reported a 2-hour wait Wednesday, down from more than 4 hours earlier in the week. Airport officials say it can't continue like this. And that's it for the Business Minute. I'm Antonia Atkinson.
Thank you, Antonia. Time now for the top stories from around the world.
In the region, the CARICOM Reparations Commission says the push for reparatory justice is at a defining moment with growing global support. Marking the International Day of Remembrance of the Victims of Slavery, the Commission renewed its call for compensation and structural reform to address historical injustices. It also welcomed the African Union's Decade for Reparations as a major step forward. The Commission paid tribute to millions who suffered under slavery while urging the international community to take decisive action. And on the international scene, the Centers for Disease Control and Prevention has issued a travel alert for dengue fever, a mosquito-borne illness. 16 countries, including Colombia, Cuba, the Maldives, and Pakistan, are reporting higher than usual cases or cases among returning U.S. travelers. Symptoms include fever, rash, nausea, vomiting, and joint pain, earning it the nickname breakbone fever. Severe cases can cause internal bleeding and require immediate medical attention. So far this year, the U.S. has recorded about 500 cases. And those were the top regional and international stories. I'm Aliyah Bryant.
Thank you, Aliyah. We head to a quick break. When we come back, we'll have your midday sports report. And we apologize for the absence of the audio on that clip. Now to other news. The Southeast Regional Health Authority is making a strong appeal for persons to use health centers first for non-emergency care. The move comes amid ongoing concerns about overcrowded hospitals and long waiting times. This is particularly in emergency departments.
Most health centers operate between 8 a.m. and 4 p.m., with selected locations offering extended hours up to 8 p.m. to better accommodate the needs of the public. Health centers are staffed by trained and qualified healthcare professionals who are committed to delivering high-quality care in a safe and welcoming environment. Patients can be assured that they will receive appropriate treatment and, where necessary, will be referred to hospitals or specialist services.
Public Relations Manager Sarah Shawana Johnson Benjamin says many of these delays can be avoided if patients seek treatment at community health centers instead.
A wide range of services, including general medical consultations, maternal and child health services, immunization, pap smears, wound care, dental services, nutrition counseling, eye clinics, and chronic disease management for conditions such as hypertension, diabetes, and heart disease. Additional services include family planning, mental health support, HIV/STI testing, and health education.